to racial equality, the infrastructure bill has $400 billion focused on home health care aides. A lot of them are women of color. How is that infrastructure, and explain why you see home health care workers as part of infrastructure?
Well, first, this is essentially a jobs bill. Yes, there's a lot in here that is infrastructure, but as the secretary just conveyed, our workers, our workforce is part of the backbone and the infrastructure of America's economy and communities. And if you have home health workers, as you noted, who are predominantly women of color, there are predominantly workers who are paid often $11 an hour about on average. These are communities and individuals who need greater assistance and need greater help. In addition, the people who are impacted most by the need for caregiving are women. We see that statistically. About 2 million women have left the workforce as a result of the pandemic. And so our objective and our focus is on addressing physical infrastructure, the infrastructure that is going to help us compete, including broadband. This is a broadband map. I love maps, don't you guys? This shows where there is not great broadband around the country, which I think is so interesting and shows you how much we need to do, what we need to do to address it. But if we're going to get women back in the workforce, this is an area where we need to address. And so the President felt it was an important and imperative part of the package. And as the Secretary noted, it's something that many businesses are also welcoming.
Two quick questions. They're one's a yes or no question.
Sure.
President Biden has indicated that Beau Biden's cancer was likely caused or linked to burn pits. This is a question from our foreign team. Does President Biden and the White House support the bill Senator Gillibrand and Senator Rubio have sponsored related to burn pits?
I'll have to look more specifically at the bill. He has talked about this quite frequently, including when we were in, I can't remember what state, where he visited the hospital. I don't remember. Ohio, thanks. It's like a phone a friend. When we were in Ohio, he talked about this as well, but I can check with our legislative team.
Supports the bill.
I haven't looked more deeply into the specifics of the bill.
And my last question is on immigration. The Family Reunification Task Force, as of now, is saying that it hasn't reunited any families because they're still sorting through the system. I wonder, can you talk a bit about why they haven't been able to reunite families, and what are the concerns and challenges that maybe are even more pronounced than you would have thought they were going to be?
Sure. First, we can't overstate how complex this challenge is. The prior administration did not have a system in place to track the children and parents who were separated. They also, of course, separated them themselves. But the task force has been in place, as you know, for about 2 months. The focus right now in this period of time has been reviewing thousands of records, and a significant number of issues have come up in these existing files, including incorrect dates and names. They are working to establish a database of families who were separated and working to find previously unidentified separated families who are eligible to receive benefits through the task force. And they've also identified over 5,600 new files that were not reviewed and have begun the process for reviewing and cross-checking those files. The task force is also working very closely with the ACLU to process identified families so we can reunite them as swiftly as possible. They'll have a full report that's due on June 2nd.